Welcome back in some Eastern Shore communities, getting medicine can be a challenge. So those living on Smith Island, that's an area we've covered extensively, for example, only get their medication delivered by ferry.
Yes, pretty cool. University of Maryland researchers are trying to make it easier, delivering medicine via drone. They're in the middle of gathering data in a pilot program.
Our Dennis Flair on your corner in Somerset County, where he saw that testing in person.
Sending into position.
It's a sight people in Crisfield have grown used to.
We're delivering.
Drones flying around carrying a box. That box you see is holding something very special for Susan Heath.
Delivery complete.
Her medicine.
It was different than going to the pharmacy.
Heath admits she's not sure she'd do it again, being able to drive and living close to Marion Pharmacy, but she sees the convenience to it.
Sometimes you can't get to the pharmacy when you need to get to the pharmacy, and the drone would be able to drop stuff off and be much better.
Especially for her neighbors.
We live in a very small community. There is transportation issues. We have a lot of elderly that can't get out. We have not just elderly, we have other infirm that just can't get out, and this would be wonderful to have it dropped in there.
Crisfield became the testing ground for University of Maryland's Medical Delivery Pilot Program, managed by the university's UAS Research and Operations Center, or UROC. The university also is partnering with the company DroneUp.
Approaching delivery point.
All the delivery drop-off points are programmed into the drone. DroneUp monitors to make sure the drone won't run into something and that there's no issues with drop-off. Once the delivery is done, the drone comes back to make its next delivery. With the data gathered here, the university is seeing how cost-effective this kind of delivery could be for pharmacies like Marion, as Marion already drives prescriptions to some of their patients.
Eventually, researchers are working to get a drone over the Chesapeake Bay to Smith Island, which currently is only accessible by ferry. Now, the drone that will be able to do that, though, it's going to be bigger than this one. This drone, it's about 55 pounds. The one that will go over the Chesapeake Bay, that will be about 65 pounds.
Do we want to make things better?
John Slaughter is UROC's director. He says talks about this started years ago, but it was really thanks to a federal grant awarded to the state last year that got the ball rolling. Since then, Slaughter has become well-versed on medical access here and what happens when people are not getting their medicine on time.
What you wind up with is problems with compliance with those medical programs. And when that happens, people get sick, people wind up in the hospital, and so forth.
Right now, medicine is delivered once a day by ferry to those on Smith Island, but severe weather and other obstacles can prevent deliveries for days. Slaughter stresses this research is not aiming to make the ferries obsolete. He just wants another option available.
We know the boats are running and they're getting, and that's established and that works. But there's times they can't go. We want to stack on top of that, make sure people get their meds. If there's an urgent case, then potentially we can help with those kinds of things.
Test deliveries to Smith Island are next. The University of Maryland is also partnering with the State Department of Planning on this research. Reporting on your corner in Crisfield, I'm Dennis Flair for WJZ.
You gotta admit, that's pretty cool.
Times are changing, I'd say.
Absolutely. And convenient for them.
Makes it a lot easier for them. All right.